after the age of 50 suffer from some sort of male pattern hair loss or male pattern baldness. Now, this is not something that you need to just live with. There are multiple treatments. Treatments range from everything from a medication, a daily pill, to surgical options. Another treatment that I offer in my practice is platelet-rich plasma treatment for hair loss or thinning hair. Now, as opposed to hair transplant, which is a surgical procedure and takes hours upon hours in order to achieve the result, as opposed to hair transplants, which takes hours to perform and takes months in order to see the results, what platelet-rich plasma involves is simply drawing your blood, which contains red cells, white cells, and platelets, among other things, and then we in turn take out the platelets, spin them down to their purest form or platelet-rich plasma, which we in turn inject into the scalp in order to stimulate failing hair follicles. What this does is it helps the hair follicles that are destined to not grow hair anymore and helps them continue to grow hair. It generally involves approximately 3 treatments 1 month apart. Each treatment takes about a half hour to 45 minutes and involves drawing your blood, spinning it down, and taking only the platelet-rich portion of the plasma and injecting that into the scalp. Now, the platelet-rich and the platelet-poor mixture, while it may work, is not as efficacious as using only the platelet-rich portion of your plasma. Generally takes at least 3 treatments in order to start seeing a result, and in general, I tell my patients they can expect anywhere from a 25 to a 35% increase in hair growth. Now, where this has its greatest impact is in someone who is losing their hair. It can turn around the hair loss pattern that someone may be suffering. If someone has already lost their hair or they are bald, it generally does not improve the growth of the hair. In general, if someone is already bald, the platelet-rich plasma treatment for hair growth does not really yield much success. Now, this treatment can also be used for women because, don't forget, women can also suffer from hair loss. Also, women especially women who use quite a bit of extensions in their hair get what's called traction alopecia, or as the weight of extension over time can pull the hair out. So it does help regrow some of the hair in that situation. What the treatment involves is, obviously, you come into my office, we give you a shot in the scalp to numb up the entire scalp, and once that shot is done, the process is entirely painless. Then we draw your blood, treat the blood, and take out only the platelet-rich portion of the plasma, and then that in turn is injected into the scalp in the area of thinning, and that is injected into the scalp in the area that is thinning in order to increase and stimulate hair growth. And as I said, it generally results in an increase of hair growth of about 35%. So as I tell my patients, someone who's got hair thinning, you increase their hair growth by 35%, you'll make a difference. If someone is bald and you increase their hair growth 35%, you're really still bald. So it is really designed for someone who has thinning hair, not bald. In addition to the PRP treatment for the thinning hair, we do give the patient a special medicated spray which I want them to apply to the scalp area every evening. There are 2 different types of spray, one designed for men and one designed for women. As stated before, the PRP treatment for the scalp requires 1 treatment per month for 3 months, and then a once annual treatment in order to maintain the increase in hair growth. Obviously, if anyone has any questions or wants to schedule an appointment, please contact my office at 212-628-7300, or again, visit my website to learn a little bit more about this and schedule an appointment at www.normanrowemd.com. That's www.normanrowemd.com. Thanks for watching.